Hi, good evening, everyone. My name is Varun Gupta, and I'm founder and a CEO with Zorgers Home Healthcare. So at Zorgers, we are fully committed in terms of providing the organized care for dependent elders and bedridden patients. So as a part of our constant approach towards improving and bringing new and new subject towards the healthcare, the people who are already availing the healthcare support system for their parents, for their grandparents, for their connected family members. So we intend to bring new and new health avenues for them to be able to understand, how the medical sciences is coming together in terms of improving the quality of life for people in all possible age groups. Okay. So today, the one of the important subject that we picked up is the holistic healthcare, right? So we all would agree that after post-COVID, a lot of things have changed and the way we have used to look at our health, our lifestyle has changed tremendously, right? So one of the most important things to be talked about is that how do we today look at our healthcare in terms of day-to-day things in a post-COVID kind of an era, right? So we thought that we should bring the best of the brains, best of the minds to talk about it. So hence we have come out of panel. So I will give a quick introduction. So today I'm going to be joined by dietitian Anupreet. She's a nutritionist, and she is highly passionate about nutrition as a subject. She's actually an enthusiast of integrative nutrition. She's a founder with Ditora. Help me, Anupreet, I hope I'm spelling it right. So Ditora is her venture wherein she helps her clients with appropriate knowledge about the food and holistic nutrition. Okay. And she's greatly passionate about the subject. She's going to cover the nutrition element about in our today's day-to-day lives, right? So then I am also being joined by Anchal. Anchal is a counseling psychologist working with the Department of Mental Health and Behavioral Sciences, Fortis Healthcare, Mohali. As a part of her work, she provides the counseling services to both inpatient and outpatients on various psychological issues. She has been very active conducting workshops in various schools with parents, students, and teachers on life skills, right? And mental, and especially the mental health related. I think Swasthya Society, educating children for a better tomorrow, collaborated in a project with CSAME Workshop India Trust on children protection, which focuses on encouraging children in activities which would interfere in their mental health state and family dynamics. Very, very vibrant personality. I've met her personally a couple of times, so she's very passionate about the mental wellness as a subject. And we all somewhere would agree that today, in this kind of the stressful life that we are living, how important is the element of mental wellness, especially in the post-COVID, we all are gradually realizing day by day this element. I'm also going to be joined in today's discussion by none other than Dr. Vineet Sagar. Dr. Vineet Sagar is a renowned neurosurgeon in the region. He is the head of neurosurgery with IVY Hospital, Mohali. So besides the fact that he's a gem of a doctor, he's a great human being, someone I know him personally so closely, right? So, the whole idea of bringing him to a panel, it is not about the neuro as a subject that we are going to talk about, but though he is a specialist, we can always ask questions related to the neuro also. Being a panelist is more related to the idea, what is the role of medicine in a post-COVID era. As an allopathy doctor, he's going to talk about, not just focusing around a medicine, but in general in a holistic kind of a framework, right? So I think I would request Anupreet, she's the right person to take this discussion forward. Over to you, Anupreet.
Thank you, Mr. Varun. A very good evening, everyone. First of all, a big thanks to Team Zorgers, Mr. Varun, the founder and CEO of Zorgers, for initiating this step, and especially Namrata and Pilakshi, who've been coordinating day and night with me. So I've been introduced well by Mr. Varun. Thanks a lot. And let's talk about holistic health, and specifically, if I'm talking about holistic nutrition. So holistic nutrition is a new approach, I would say, but not a new concept. It's about, it's a form of treating or healing a person in a wholesome manner, taking into consideration their body, mind, and spirit. So it includes the hands of multiple health, Western medicine, and will go beyond treating a single symptom and will treat the person wholesome rather than just supporting treating of one symptom. When we go to a doctor, or when we visit a nutritionist, when we visit a psychologist or any other healthcare professional, we do not talk about multiple things, but we tell them, I have just this problem. But when, as a healthcare professional, we are treating a patient or a client, we are taking a number of things into consideration. In the similarly, reason being, we have different aspects, and these aspects include the physical, chemical, mental, emotional, spiritual, and environmental aspects. And we have this diversity even between two individuals, as I say, even if they are living in the same house with the same parent, because it's not about, if I'm taking nutrition, it's not about food, it's about health, mental health, it's about what environment they're coming from, it's about their cultural background, their ethics, everything, even their emotional well-being. So when I ask them, how happy are you with food? What is your relation with food? This has to be taken into consideration. Follow it. It's about what is your perspective about food. How are you going to take food when you leave the dance? It's about that. It's about how good your relation is with food. Are you happy while eating it? What is your emotion? We have a number of patients who have eating disorders. Reason being, their relation with food is not good. They feel food will make me fat or food will make me lose a lot of weight. They binge eat, or they are patients with anorexia nervosa. This is how we have to treat people holistically. We have to see how they are perceiving their environment. Okay, so I think all these aspects, when we are taking into consideration, this is about nutrition, and this is the reason we have this panel discussion session. And we'll talk about what is holistic medicine and holistic psychotherapy, and help with this. Along with this, I believe nutrition education is also a very primary tool, because this is what we are doing here today. It's educating people, right? So nutrition education, or treating holistically and educating holistically, because we honor everybody's innate wisdom, and by working on their principles and empowering them through holistic medicine, I'm sure they'll be very much helped, and you're treating everybody holistically. And one thing, sustainably. I think this term was missing with us, sustainability. This is a very important thing. So I think I'll take it forward, and we'll start with Anchal ma'am. Ma'am, what is your perspective on holistic medicine in a mental view?
All right. Firstly, Anupreet, I think very well said, whatever you said about the holistic view, in the sense of that when we go to a doctor, I think the most important thing is that we need to take things holistically, which we actually are not aware of. And I think before this also, we had a session on World Health Day. And there also, I think the guest speaker talked about that, how there are not preventive measures, how people are not aware of many of the diseases. And of course, about the mental health aspects also. And being a professional in the mental health aspect, I think approach towards life, when we talk about the holistic wellness, it is a very multi-dimensional concept that we need to take into consideration. And when we are talking about the multi-dimensional approach, there are few things that comes into the picture. Number one is your physical health. Number two is your emotional well-being. Number 3 is your social well-being, and number 4 is your spiritual well-being, and then number 5 is your mental well-being. So this is how we need to take a multi-dimensional approach, where you are physically taking care of yourself, emotionally and socially you have a social support system, how you are thinking, how you're feeling, how you're acting out on things. Do you have a support system where you can actually go out and talk to the people? And of course, psychologically, how you're taking care of yourself. So when we are talking about the mental view in the holistic, one is the emotional part, that how I'm thinking, how I'm feeling, and how I'm acting to a certain situation. Then comes the psychological part, कि मुझे stress होता है और उसमें stress को handle कैसे कर रहा हूँ या कर रही हूँ, मैं manage उसको कर पाता हूँ या नहीं कर पाता हूँ. Third is the social approach, where I need to understand that how am I relating to that, relating to the people around me, to my environment, to my surroundings, and am I able to make choices and decisions for my own personal life and for for my work life. So वो डिसीजन मेकिंग, वो आप किस तरीके से अपने environment से relate कर रहे हो, लोगों से relate कर रहे हो, उस चीज को समझना हमको जरूरी होता है. And when again we are talking about the holistic approach as a mental view, here we of course take into consideration the medicinal aspect, but most importantly it's the person that we see as a whole, an individual seeing as a whole. Because when a patient is coming to me, the first and foremost thing which is important for me is the emotional, psychological support that I need to provide the patient, the comfort, the particular support that I'm able to give to the patient, and also to the family and the community in general. Because when an individual is not in the right place, of course the family is also not in the right place. So seeing the individual as a whole is very important when you are watching the holistic approach in the mental view. And of course, providing them the therapeutic techniques that are needed, which can be a talk therapy, which can be a group sessions, which can be mindfulness sessions, which can be meditation sessions. So whatever is needed in those therapeutic techniques, that is another approach to the holistic wellness. And I hope I sum it up.
Thank you, ma'am, for a beautiful answer. So I just sum up in few words. She's talked about multi-dimensional approach and the 5 basic components of holistic health. And the multi-dimensional approach has to be like divided into 3: the emotional, the management part, and the social aspect. So thank you so much, ma'am. So Mr. Vineet, sir, Dr. Vineet, so what is your perspective on holistic medicine?
Anupreet, I think you guys have covered almost all the parts, and most of the times, people complain, doctors, they just treat, or they just operate. It's not like that. Whenever a patient comes to us, suppose he comes with a, spinal cord injury or maybe a clot in the brain, we just operate. Yes, at that point of time, we treat that because most of the time it's an emergency. We have to treat it. But then there are many other things which come into, that's how actually I came in contact with Varun also. If a patient has a spinal cord injury, so it's not just that I have to fix the spine or I have to remove that clot, remove that tumor. I have to see how I'm going to, that patient is going to be dependent. You have to see how many people are there in the family, who will be taking care of the patient. Unfortunately, many a times, many times, in our, our setups, most of the setups, in fact, there is a aspect of, psychological support, counseling. Many of these patients, they are chronic patients, brain tumor patient, he might be dependent upon his family for a lot of time. Suppose, just for people like us also, if we were asked to stay at homes, many of us craving to go out just to do our work. So if a person who has been so active and he is confined to bed for 3 months, people complain, not many people are able to pick that up. So that is what we pick up in the OPD. That aspect has to be addressed. It requires psychological support, sometimes even counseling by a psychiatrist, maybe even treatment also. I remember, one of my patients, he came with a severe head injury, right? He remained on ventilator for 14 days. He was there with us for almost 2 months in the hospital. And what happened? Uh, by the time he, recovered and got back, went back home, I got news 10 days after after he was discharged that he committed suicide. So I was like, numb. What happened? And very close to me. They came to me. That's how I came to know that he has committed a suicide. So I asked them, what was the issue? I mean, what is the, what was the thing? Because he had come with a severe head injury. I had to operate him. I just asked how the head injury happened. But actually, he was trying to run away from his home, and that's why he was driving very fast. That's how he had his head injury, because he was trying to run away from his home just to be with his partner, and they were not allowing him to get married to that girl, and that is why he committed suicide. So how things are interlinked, how much psychological support a patient requires, that is sometimes your patients they teach you. That is when I realized, neurosurgery or even spine surgery is not just about putting few screws or operating. You have to see how active the patient was, how he is going to feel being confined to bed for maybe 2 months or 2 months or 3 months. That is where, that's how I met Varun also, requiring home care support for the patients, sometimes requiring a psychologist or even a psychiatrist help for counseling purposes, so that the patients they are in the right frame of mind. If you don't do it, the recovery time sometimes is very prolonged, and it adversely affects the recovery. So it's not just holistic approach is important for a nutritionist or other allied branches. It is equally important for us surgeons also. The point is how many times we pay attention to it. That is the more important point.
Very rightly explained, sir. The interlinking between mental, emotional well-being and holistic health. Very rightly said. So,
Recovery of any patient of a prolonged illness, it depends a lot upon his. I mean, in neurosurgery we say it quite often. Those patients recover whose family members they get involved in the recovery of the patient. If you just leave it to the caregivers, no, then recovery is not that satisfying or not gratifying actually.
very rightly said. So, Anchal ma'am, what do you say when should a person consult a psychologist? View of what a psychologist does or what a psychiatrist does, and people are very scared. Honestly speaking, people are very scared. So, what do you think? When should we consult you?
Okay. When should you consult me? नहीं बोलूंगी मैं. When should you consult a professional who is a psychologist or a psychiatrist or a clinical psychologist, I would rather say. So I think firstly, I would really agree with Dr. Vineet, what he just said. And I think taking that into consideration, of course, we have been, as Fortis Healthcare, we have been doing that work, that we go for all the counseling psychologists that we have in the team. We all go for the IPD rounds, and we meet the patients who are admitted here for more than 7 days or so. And even if the particular team feels that this person needs a psychological consultation, they do refer to the psychologist or the psychiatrist, right? And I think when you go and when on daily basis I go and meet those particular patients, I actually there are few of the people who say nahi humko zarurat nahi hai, hum pagal nahi hai. Ye answer aata hai kabhi kabhi. And sometimes there are people who really love to talk to you, who really start telling you about the stuff that they're dealing with. And it is actually very I feel very happy. They are here for their medical problems and illnesses that they're having physically, but overall they are stressed out because of that particular thing that is going on with them physically. If I can share, there was one incident that happened yesterday itself. I went to the ICU and I met a particular patient there, and he's having cancer. He got to know that he's having cancer after so many months. He was having this particular pain in the stomach, and he used to take एक मेडिसिन स्टमक एक के लिए, जो वो खा लेता था, ठीक हो जाता था, फिर हो जाता था, फिर खा लेता था. तो वो चीज इतनी प्रोलॉन्ग चलती गई. फाइनली जब उसको स्ट्रोक आया, कुछ आया, तब वो डॉक्टर के पास गए. जब उन्होंने अपना MRI कराया तो पता चला दैट इट इज अ कैंसर, विच एक्चुअली जो इतना ज्यादा बढ़ गया था उनकी बॉडी में कि वो उनके ब्रेन में भी पर्टिकुलर lumps and everything बन चुके थे. So here I think again it is very important for us to understand and educate ourselves about the same, become aware of the stuff कि आपको अगर कोई प्रॉब्लम हो रही है, हमें प्रोफेशनल के पास कब जाना जरूरी है. सो एज यू टॉकिंग अबाउट, हमें एक मेंटल हेल्थ प्रोफेशनल के पास कब जाना जरूरी है. सो देयर आर फर्स्टली डिफरेंसेस बिटवीन अ साइकियाट्रिस्ट, a काउंसलिंग साइकोलॉजिस्ट एंड क्लिनिकल साइकोलॉजिस्ट, जो अगेन हमें समझना जरूरी है एट अ ब्रॉडर, जो ऑफ कोर्स आपके सिम्टम्स को समझेंगे, अंडरस्टैंड करेंगे, और वो आपको एक पर्टिकुलर डायग्नोसिस प्रोवाइड करेंगे आपकी प्रॉब्लम के लिए, और आपको मेडिकेशन के थ्रू हेल्प आउट करेंगे. A counseling psychologist, whereas they have a master's degree or a PhD in the same, and they give you particular therapeutic techniques. They provide you a talk therapy. They provide you various other techniques which can help you to and a vent out space, of course, which can help you to come out of that particular problem. It could be DBT, it could be CBT, it could be other various techniques. With a clinical psychologist, they also of course provide the therapeutic techniques, but they have a emphasis. अगर आपको IQ की टेस्टिंग करानी है, आपको पर्सनालिटी असेसमेंट कराना है अपना, तो उस चीज में आपको क्लिनिकल साइकोलॉजिस्ट हेल्प करते हैं. So here I think understanding these particular differences, educating ourselves of the particular professional help that is near to you, which is very very important. And when you should visit a psychologist or a psychiatrist or a mental health professional is जब आपकी पर्टिकुलर डेली एक्टिविटीज में प्रॉब्लम आने लगती है, राइट? स्ट्रेस हम सबको होता है एट अ सर्टेन पॉइंट. इफ आई एम ऑन दिस साइड ऑफ द टेबल व्हेन आई एम डीलिंग विद द क्लाइंट, दैट डजंट मीन आई एम नॉट स्ट्रेस्ड आउट. I also have 100 of things in my mind which makes me feel stressed out. But at the same time, it is important for us to understand कि अगर वो स्ट्रेस आपका इतना ज्यादा बढ़ चुका है, 2 week से ज्यादा हो गया है, फंक्शनिंग को प्रॉपर्ली नहीं कर पा रहे हैं, दैट्स वेयर यू नीड टू अंडरस्टैंड दैट आई नीड अ प्रोफेशनल. एंड आई थिंक सेम इज लिंक्ड. नहीं बने हम खुद प्रोफेशनल नहीं बने, यू नीड टू गेट इट रेडी, यू नीड टू गेट योर इंटरवेंशन प्लान, यू नीड टू गेट योर असेसमेंट्स डन ऑन द सेम. एंड so yeah, if really concerns and the problems are there, you need to understand that you need to visit a professional.
Anchal ma'am, we got to know how important it is to consult a professional at the right time, and we should not ignore the symptoms, and instead we should consult a professional in the stream, maybe a psychologist or maybe any other healthcare practice, and and don't ignore the symptoms. Just get them treated. So I have a question for Mr. Vineet. Sir, what do you think how important it is to have medical self-care and how effective it is for any age group?
Can you just repeat your question? It just skipped. I mean, there was a break in the.
So I
connectivity.
was asking how important it is to have medical self-care and how effective it is for any age group.
See, medical self-care is you can read about everything on the internet. So for initial, whether to go to a doctor or not, that for that purpose, medical self-care is okay. But once you are starting having symptoms, as Anchal pointed out, a patient was having a stomach ache for so many months, and he just used to. I think I'm not sure he'd be popping up few PPIs, that is antacids, and he would have felt nice. But you have to think, if a thing is things are not getting resolved, then you need to consult somebody. So medical self-care, yes, a good idea. I mean, a lot of screening packages are available with the labs also. You can, but they should not lower you into the sense of overconfidence actually. So I mean, as I said, medical self-care, yes, idea. I'm all late. So you can get. They should. I mean, both the things should go hand in hand. Not exclusivity should not be given to anything. I mean, not all the doctors can screen the patients. Also, we don't have so many doctors. Neither doctors have so much of patience also with the workload that they can screen the patients whether you are having. You can do a medical health for every person in the world. Yes, for that purpose.
So, Anshul ma'am, we have another question for you. What do you think triggers the holistic mental health in people?
Okay. So I think if I talk about the triggers that come into our well-being, firstly, we need to understand about stress. So stress comes in two parts for us. So it's a positive stress sometimes and it's a negative stress sometimes. So the positive stress is basically known as U stress, EU stress. And the negative stress is basically the distress. So अगर मुझे पता है मेरे बॉस ने मुझे एक प्रेजेंटेशन दी है और वो प्रेजेंटेशन मुझे एक अच्छे कॉन्फ्रेंस में दिखानी है, मैं उसको करने के लिए मोटिवेटेड भी हूँ कि मुझे ये चीज करनी है, राइट? सो इट इज अ पॉजिटिव स्ट्रेस that is coming on to me that I have to clear of my boss stress कि हाय राम जी कैसे होगा, मुझे एंजाइटी हो रही है, मैं तो कर ही नहीं पाऊंगा, I'll fail actually, my boss will actually give me threats, then I'll lose my job, things will happen to me. So this is a negative stress that is building in you, which is known as a distress. So if we are able to understand this particular stress, कौन सा मेरे लिए एक पॉजिटिव स्ट्रेस बन रहा है और कहाँ मेरे लिए फाइन लाइन आ रही है that it is becoming a negative stress for me, wherein I'm having some negative thoughts attached to myself, attached to the people in general with me and to my future. वहां पे आपके नेगेटिव थॉट्स बिल्डअप होने लग जाते हैं किसी सर्टेन सिचुएशन के लिए. नाउ कम्स द पार्ट जहां पे स्ट्रेस जो है वो बिल्डअप होने लगता है. पहले वो आपका एक्यूट है, वो एपिसोडिक है, प्लस वो क्रोनिक है. एंड जो क्रोनिक स्ट्रेस है वो सबसे ज्यादा डैमेज करता है आपको. सो फिजिकल स्ट्रेस आता है हमारा, साइकोलॉजिकल स्ट्रेस आता है एंड प्लस हमारा साइको सोशल स्ट्रेस आता है. सो व्हेन वी आर टॉकिंग अबाउट द फिजिकल स्ट्रेस, मुझे बॉडी में मुझे एक्चुअली माइंड में लॉट ऑफ स्ट्रेस इज गोइंग ऑन विद मी राइट नाउ. आई एम नॉट एबल टू परफॉर्म वेल इन माई वर्क प्लेस, आई एम नॉट एबल टू परफॉर्म गुड इन माई फैमिली लाइफ, and that is creating physical stress to me in the sense that I'm having a lot of body aches, I'm having pains in my body, I'm having headaches, I'm having muscular twitches, my skin. So these things keep on happening जहां पे आपका जो stress है वो physically आपके ऊपर आने लग जाता है. Second thing that comes into picture is the psychological stress, जो कि कुछ तरीकों से आ सकता है, जैसे कि मुझे कोई past trauma है, right? There might be a particular person who I lost in my life, which was very, very close to me, and trauma that is building onto my stress. Another thing could be that मेरी डेली लाइफ के कुछ ऐसे हैसल्स हैं. फॉर एग्जांपल मैं अपनी वर्क प्लेस पे आ रही हूँ बट मैं बहुत परेशान हूँ रोज रोज अपने काम से, अपनी चीजों से. लोग जस्ट पाउंस ऑन मी, थिंग्स हैपन, एंड व्हेन आई एम गोइंग बैक होम आल्सो माय spouse is also not giving me that attention that I need. Maybe my children are also coming on to me and saying me आप तो अच्छा से खाना नहीं बनाती हो, आप ये नहीं करती हो, वो नहीं करती हो. So these are the daily life hassles that I am actually engaged in, which is creating stress for me. Then comes the recent जो भी लाइफ इवेंट्स आपके हो रहे हैं जो आपके लिए स्ट्रेस क्रिएट करते रहते हैं. और साइको सोशल स्ट्रेस जो हमारा क्रिएट होता है, अगर मुझे लगता है मैं रिस्पेक्टेबल नहीं हूँ अपने सोशल स्टेटस में, मेरा जो सेल्फ एस्टीम है वो मेरा इतना अच्छा नहीं है, लोग मुझे उस रेप्यूटेड तरीके से नहीं देखते हैं, मेरा कोई कंट्रोल नहीं है अपने एनवायरनमेंट में. लाइक मोस्ट ऑफ द एल्डरली पीपल दैट आर हियर आउटडोर, आई टेक सेशंस विद, वन ऑफ द मेजर थिंग दैट दे ऑलवेज से इज कि बच्चे हमारी सुनते नहीं है. राइट मैंने उनको इतना पाल पोस के बड़ा किया, मैंने आज तक उनके लिए सब कुछ किया, और आज जब मेरी बारी आई है तो दे डोंट हियर मी आउट. एवरीबडी इज टुगेदर एंड आई एम द वन हु इज लेफ्ट आउट, एंड देन आई डोंट अंडरस्टैंड व्हाट टू से, व्हाट टू टॉक अबाउट. सो आई डोंट हैव एनी कंट्रोल ओवर माय particular environmental space. That is another particular stress that triggers you to a particular space जहां पे आप अपनी well-being पे ध्यान नहीं दे पाते हैं. आपको लगता है मैं acceptable नहीं हूं इस particular group में. So to sum it up all, there is a gas model जो हम साइकोलॉजी में बात करते हैं. उस गैस मॉडल के 3 पार्ट होते हैं, अलार्म, रेजिस्टेंस एंड देन कम्स द एग्जॉशन पार्ट. तो मेरे को एक अलार्म आ रहा है, एक सिचुएशन आ रही है और उसमें मुझे समझ में आ रहा है कि मुझे स्ट्रेस हो रहा है, स्ट्रेस हो रहा है, स्ट्रेस हो रहा है, और वो बिल्डअप होता जा रहा है, मेरा बिहेवियर उसकी तरफ जा रहा है अवॉइडेंट, मैं रेजिस्ट कर रहा हूँ. एंड देन कम्स द एग्जॉशन पॉइंट जहां पे वो प्रेशर कुकर एकदम फट जाता है और आप इतने एग्जॉस्ट हो जाते हो, आपके केयर गिवर्स इतने एग्जॉस्ट हो जाते हैं कि किसी को समझ ही नहीं आ रहा है कि अब इस पोजीशन पे करना क्या है, एंड वेयर इन योर इलनेसेस आर कमिंग टू अ पॉइंट where it is all exhausted and you are not able to do anything out of it. So these are all the particular things that creates a trigger for us in our daily living, and we actually come to a point as individuals or as families that there is a point jahan pe hum exhaust ho chuke hain.
Right, ma'am. So just summing it up for everybody, and thank you for the elaborative answer, because we've got to know what stress looks like, and how we are actually able to identify, and this is something what triggers our mental health, and especially the gas model, which is very elaborative. And I'm sure I'm going to read more about it when I'm after the session. So, Dr. Vineet, we have another question for you. Can you please explain and highlight some of the techniques, like we have integrative medicine, alternative medicine, or complementary medicine? What are these? And because these are some of the most trending terms these days.
Right. Yes, integrated medicine, alternative medicines is any other form of medicine like allopathy, apart from allopathy. No, you have homeopathy, you have Ayurveda. So these are alternative form of medicines. This is the terminology used to, just describe. I mean, just address these things. As far as integrated medicine, yes, there are efforts to integrate, by the government also, to combine and get something out of, the best out of all the three, forms of medicines what are prevalent in the present day world, like, allopathy, homeopathy, and Ayurveda. Right now we don't have anything concrete as such, but there is an effort to go into that side. But of course it will require a proper R&D before they can be actually put into practice, because most of the times the medicines used in allopathy, they have been, researched a lot. They have, there have been trials before they are actually put into, that amount of trial has been done for homeopathic medicines, or even Ayurvedic medicine. We don't know. It's just a hearsay, that these medicines have been used for, centuries. So just like, let me assure and warn you also, don't consider, all the homeopathic and Ayurvedic medicines just safe and indiscriminately use them, because they are also medicines because of cure. But whenever you give anything artificial, even if it is just a psychological counseling, if it is not in the right direction, or for not for the right purpose, it can actually harm. I'm pretty much sure Anchal can tell you, if a psychiatrist misdiagnose this is a patient of schizophrenia, and it's just a kind of a schizophrenia where a patient stays quiet and sends you for psychological counseling, how should it make a difference? It does make a difference, because it is not good for, and that patient. So similarly, medicine is a term used for something which is used to think. It's an artificial substance which is being entered into your body, of whichever branch it is. It can harm you. So yes, there is an effort to integrate the best out of all these known fields of medicine, whether it is Ayurveda or whether it is homeopathic. We all know that there are many homeopathic medicines which have beautiful response, especially in skin diseases, and they are very useful. And in allopathy, actually, there is not much of a cure available for many skin diseases, and that's where homeopathy helps a lot. Yes, it's a known fact, and it's being used. So why not make the best out of all the three branches? That's where the integrated medicine comes in. But yes, you have to tread very cautiously and carefully, and there have to be standardized protocols before actually it is brought into practice.
Thank you so much, sir, for such a comprehensive, insight on integrative medicine. Because we are hoping that in future it's not just allopathic or just Ayurveda or just homeopathic. It's an integrative form of medicine to heal people, and I hope this is a sustainable approach that we're looking forward. And ma'am, we have another question for you. What do you think are the most common issues you've come across post-COVID?
Okay. So I think, interestingly, the most common issue that I have faced is with the parents and the children. And I think the people people who are listening to me right now who have children and who are parents, they can definitely understand that pandemic has put a great impact on the children and their lives. Because I think being in the house is of course not something that we all want all the time. It is something that we actually जब हमको कोविड के टाइम पीरियड में ही हमको 10 से 12 दिन रूम में रहना पड़ा था या एक हॉस्पिटल सेटिंग में रहना पड़ा था, वही हमारे लिए इतना ज्यादा problematic हो गया था. People were facing so many issues. So for the children who actually were not able to go to schools, they were not having any face-to-face contacts, the screen time was actually increased due to this particular reason, because they were having their classes online, then their tuition classes online, and then they have to play also, then they have to watch TV also. So this particular problem, of course, has increased. And with that increase in the social media and the gadget usage, I think children have started to move on. The Z generation that we actually talk about, they started to move on to certain things which are not age appropriate for them, and wherein the parental control or a check is also not in the right place. Because aajkal, when I talk to parents, of course you have a choice to change your passwords of the phone if the child is using. A 4 or 5 year child cannot use the phone firstly without the consent of the parent, and if they're using it, it's because they the password or do something about the phone usage. Apart from that, the parents who are dealing with the teenager, इनको ये तो हमको धमकी दे देते हैं, ये कुछ कर लेगा मुझे लगता है, ये तो कुछ कर लेगी मुझे लगता है, तो मैं तो इसी डर में रह जाता हूँ या रह जाती हूँ. So these are the things that have really come up in this time period, and children have actually gone to a particular space where they are actually getting into some of the things which are not age appropriate for them. I think the Netflix, Amazon, on Hotstar, all these particular sometimes, most of the times I would actually say, which are not age appropriate for the children to watch, but they are actually watching those shows. Matlab, when patients come to me, I see that there are many things that, I am having a generation gap with a 4-year younger person than me. So 4 years is also, and teenage का जो particular age group है, वो भी WHO ने बढ़ा, कम कर दिया है. It used to start by 12 or something, but now it is starting from 10 years of age. So there have been a case, which I have actually gone through. The girl was just 10 years old, 9 to 10 years old, and she used to play games on the mobile phone. और जब आप गेम्स खेलते हो तो बहुत सारी ऐसी चीजें पॉपअप होने लग जाती हैं जो शायद अप्रोप्रिएट नहीं होती हैं, एड्स आने लग जाती हैं गेम के बीच में, and she accidentally went through that particular ad, and she went through many websites after that which was not age appropriate for her. And after that, a few months, she was crying, she was howling, she was saying, I don't want to marry anytime, these are the things which I don't want to do, this is something that I don't want to go ahead with, I don't want a partner in my life. A 10 or a 9-year child saying such things, it really has an impact. So I think social media has really taken a toll post-pandemic, wherein again children are not able to understand that what is the right way to take forward a relationship. They're not able to understand difference between a fantasy world and a real relationships that you need to have. Most of the time children are actually finding their particular friends on the social media platforms. They are actually talking to people who they don't know, which is again putting a stress over onto the parents that we don't know what is going on in my child's life. That is one thing, I think. And the second thing that has come into the picture is a lot of psychosomatic issues coming into the picture. Vineet would agree with me on the same or not, but I have actually seen this particular thing that a lot of saying, मेरे को यहाँ पेन हो रहा है, मुझे वहाँ पेन हो रहा है, मुझे pain हो रहा है. With them, the physical assessments are done being them. There's nothing that is actually concrete coming into the picture, and the cardiologist then mostly refer it to a psychiatrist or a psychologist, right? So, and then again, people are not able to understand कि ये मेरे को psychological problem है भी नहीं है. So it is basically generating from the stress that they're having, and the symptom that is coming is a physical stress. Right. So this is what I talked about in the last picture also, that a physical stress is something which is very common, which is being there in post-pandemic. And of course, the FOMO, which again is a Z language that has come into the picture, fear of missing out, is something that this Z generation is actually following on to. कि मैं ये चीज मिस कर दूंगा, मैं यहाँ नहीं होऊंगा तो ये हो जाएगा, यहाँ नहीं होगा तो ये हो जाएगा. So fear of missing out is all the time there, which is again, I think, a third particular problem that has come into the picture.
Wow, this is interesting to know what all parents have been facing, or children have been facing throughout, and especially things that have come post-COVID. Dr. Vineet, what do you think is the effect of COVID on neurological health of people? Am I audible?
I think we just need to figure out, probably it seems that Dr. Vineet has somewhere dropped out. What we can do is that I can request Anupreet if we can start picking the questions in the meanwhile.
Varun,
Okay, Vineet is there.
Varun,
Dr. Vineet is there.
I can hear you now, but can you just tell me, repeat the question?
Yes, I was asking, what do you think is the effect of COVID on the neurological health of people?
Yeah. See, just like, a psychological aspect, a lot of neurological problems have also been aggravated during the COVID and post-COVID, times. As Anchal rightly pointed out, there have been a lot of psychosomatic complaints, maybe because people have been reading too much on the internet these days during their free times, or they were just hooked onto the screen, reading a lot of symptoms, and then trying to figure out themselves. So they get alarmed and then they rush to the doctor. This could be one of the reasons. Am I audible, Varun?
Yeah, you are. We are able to hear you perfectly.
Yeah. Okay. And the another aspect which has which I have realized is sitting at home and not being able to go out. It affects you. It has affected the best of the people, especially the elderly and population, and the children as well. What has happened is many of them have actually gone into subclinical depression. They have stopped interacting with their peers on the phone also. When they have got opportunity to go out, even they have tend to stay more quiet. So these things, they have happened, and it's important to pick up these subtle symptoms and not let it progress to the full clinical depression, or hypomania kind of a condition. So these things, they have happened. It has affected a lot of people. More affected are the younger generation as well as the elderly ones. So it has happened, but now I think with things opening up, things are going to get better. And if there is such kind of a problem, I'm pretty much sure Anchal is there to help people, and her professional team is always there to help such people. And with time, I think it's going to get better.
Right, sir.
Hello?
Thank you so much, sir, for this comprehensive answer. Anchal ma'am, what do you think? How can children or students, the college-going students, especially the adolescent age group I'm talking about, how can they be benefited from social interaction?
Okay. Before that, I just want to point out to something, because a lot of people are asking questions, and I was just seeing the chats, and people are asking about the depression and the stress and everything, and what they can do as a home remedy for depression. So firstly, I think difference between feeling sad and feeling depressed, right? Depression is a clinical term, like you do not use in a layman language, and I'm having cancer. So in the same manner, you cannot use in a layman language and I'm having depression, right? Depression is something that needs to be diagnosed with a professional, that is a psychiatrist. And if you are not having any particular diagnosis formally and officially from a psychiatrist, please don't use labels for your own self or for any other else. Stress is a phase which happens and it goes, and it comes and it goes, which happens with everybody, right? But depression is something that is there with you all the time, which needs to be diagnosed professionally. So please, firstly, we would not use any kind of labels with our own selves, and won't attach any kind of mental illnesses with us. Okay, coming back to the point, social interaction. So I think not only for students, for the kids, but for the children, but I think for all of us, we humans, we are social animals. And I think for all of us, it's very, very important to have social interactions. And I think pandemic has been a great, great example for all of us to understand, because we have faced a lot of loneliness, all of us. I think no one present here who have suffered from COVID, or not even COVID, but in this pandemic period have not suffered at a point a loneliness, right? So I think I might have thousands of friends on my Facebook. I can have 5K friends on my Instagram, but when I'm crying and when I actually need somebody to be there for me, to hear me out, how many times do I think of those 5K people or those 1K people on my Facebook or my Instagram? So real relationships, as I said, is something which we really need to understand. Forming friends on social medias is a good thing. Of course, you are making a good social support system. I think that's how we all are also meeting here with each other, which is a good platform. We're sharing knowledge, but how many of us actually are using it for the right form is important. So having some meaningful connections is important. Maintaining your healthy boundaries with people is very, very important. That will make you feel content. That will make you feel satisfied. As I said, if I'm having 5K friends, that won't make me feel satisfied if I don't even have one person to talk to when I'm feeling bad. So your social support system needs to be bonded. It needs to be connected. It needs to be in a certain manner where I'm able to have my healthy relationships, where I'm having those 2-3 people in my life जिनके साथ मैं बैठकर बात कर सकती हूँ या कर सकता हूँ, जिनके साथ मैं बैठकर अपने चीजों के बारे में डिस्कस कर सकती हूँ, अपने आगे फ्यूचर के बारे में, करियर एस्पेक्ट्स के बारे में, फैमिली इश्यूज के बारे में बात कर सकता हूँ. And I think to all the males out here who are listening to me right now, I always point out to this thought that I think we all come from a very patriarchal society till now. And I think males are the one who don't talk much. They don't express much about their emotions to anybody. Even if, you know, अगर हम लोग बैठ रहे हैं, जो सारे मेल्स हैं, अगर वो अपने फ्रेंड ग्रुप के साथ बैठ रहे हैं, तो इट बी मोर ऑफ अ कि चलो यार आज ये पार्टी करते हैं, आज वो करते हैं, या यू नो ज्यादा से ज्यादा वर्क प्लेस का डिस्कस कर लिया, या काम के बारे में आगे क्या करना है डिस्कस कर लिया. बट they won't ever talk about what is exactly going on in their life, in their personal life. They won't talk about, you know, how my kids are doing. They won't talk about how mentally I am stressed, you know. They won't talk about कि मेरी वाइफ ने आज क्या किया, या चाय में आज चीनी नहीं डाल के दी थी. No, they won't talk about that. So I think I don't know if Dr. Vineet would again agree with me on this part or not. I think this is one of the reasons which research also shows that the males don't talk much about their feelings. That in general they're not expressed in comparison to females, and that's why most of the heart attacks also come in. Really need to have the right to speak firstly, and you have to forward. You can talk about your emotions and give that space to your upcoming, you know, to the upcoming generation also, to your children also. Most of you must be parents, and most of you must be having boys, you know, males as your children. So I think when we talk about the patriarchal society, it's like pink is for girls and blue is for boys, tractor is for boys and Barbie is for girls. And जब एक छोटा बच्चा रो रहा होता है घर में, जो कि लड़का है, आप सबने कॉन्शियसली अनकॉन्शियसली जरूर किया होगा या देखा होगा कि उस बच्चे को चुप कराने के लिए हम ये बोलते हैं, तू रो क्यों रहा है, तू लड़की थोड़ी है जो तू रो रहा है. So this is a common layman thing that we actually use to make that child stop. So which again we are not understanding. That becomes his core belief for the rest of his life. And trust me, if after this session, just sit 5 minutes with you and just ask yourself, when was the last time you cried? If I ask a girl out here, when was the last time you cried? It is like अभी 5 मिनट पहले, या 1 घंटा पहले, या मैं कल रोई थी, या मैं कल बहुत सेंसिटिव और इमोशनल हो गई थी, या मैं 1 हफ्ता पहले हुई थी. डेट के समेत, टाइम के समेत याद होगा. बट अगर मैं किसी मेल से यहाँ पे पूछूंगी, they'll be like, we don't know. Or maybe if we cried, it was like in the washroom, or it was like you know, somewhere down where I was all alone. Maybe I was driving. That was the time when I did that. So again, we need to build a culture of openness towards mental health. We need to bring awareness about the same. We need to give our children, the next generation, a very you know, not a gender biased particular platform platform where males and females both can come forward and can talk about their issues and concerns that they're dealing with. And that is how I think we'll bring awareness for the holistic approach. Because अगर आप लोग आगे आके अपने प्रॉब्लम्स के बारे में बात नहीं करेंगे, nobody will ever be able to understand. So वहीं पे communication gaps आते हैं, वहीं पे social interactions होती हैं. And lastly, I just want to say that आपके ये समझना जरूरी है कि when you are in 10th standard, it's not important that in 11th standard you will have the same set of friends. In your graduation, you will have the same set of people with you. In post-grad, you will again have another set of people with you. When you will start going to your particular jobs, then again you will have a different set of people that you will meet. So this is a part and parcel of life. You meet people, and you say tata bye bye also to the different set of people which you were getting engaged with in your life. So this is part and parcel. आप मिलोगे, आप नए लोगों से भी मिलोगे, आप पुराने लोगों को टाटा बाय बाय भी बोलोगे. तो उन चीजों से निकलना, एक resilience factor लाना is very important in your social interaction. आज एक breakup हो गया है तो उसकी वजह से हम बैठ नहीं सकते हैं. There must be somebody else who will come into your life, but that breakup doesn't mean the end of your life at all. Relationship, social interaction, understanding, those 2-3 people are the people with whom you need to create some nice boundaries where you can have a vent out space. और उसके अलावा बाकी सबसे hello, hi, tata, bye bye.
Very beautifully answered, and it was so interesting to hear you out, Anshul ma'am. So the point of part and parcel, and how problems build up with communication gap, and we need to cover this up for especially the male section. That's true enough. Dr. Vineet, we have another interesting question for you.
Yeah, Anupreet, I would like to interject before you ask me the question.
Yes.
I'd like to throw some light on that heart attack issue. Actually, yes, I won't comment on that crying wala part, but heart attack is more common in males. It's a hormonal thing. It's not related to whether they cry or not, right? Once this is proven fact, once the females they have menopause, right? After that, at least 5-7 years after that, their incidence of having a myocardial क्या कहते हैं, event is same as that of a age matched as well as habit matched male, right? I mean, of course, there are certain habits which is more common in our society in males, that is smoking and drinking, which predisposes them to heart attack more. Agreed. But if a person is age matched and habits matched, then the after the age of 40, the chances of having a heart attack are same in males and females. Regarding that, why the males cry more, don't cry, or they don't open up, again, it's a hormonal thing. I don't have a study to quote, so I will not comment on that. But this difference is there because of the hormonal factors, not just because we males don't cry more or they don't open up more. Yeah, now you can go ahead with your question.
Yes, sir. Thank you so much for your insight into this. We have a question for you. Like, what is the effect of prolonged lack of exercise on spine during COVID and post-COVID era?
Yeah, Anupreet, we have had a lot of problems in COVID as well as post-COVID era both, because generally the movement activity was reduced during the COVID times, right? So this resulted in lack of exercise, as well as in more weight gain also, right? Staying more at home, watching the screen, eating less of exercise. Of course, many of us we tried to use our rooftops, to do some kind of exercise, develop a routine, but still it does not actually match to the regular amount of activity what we are able to do now. So it definitely increased the number of spine problems in the uh, general population. Again, as I said, the worst affected were the elderly ones. Their movements restricted, weight gained more. Their basic metabolism is already in elderly it is lower. So because of all these reasons, they had more of spine problems, back pain increase. A lot of patients they had increased disc prolapses during this time. In fact, to be very honest, immediately post COVID, number of spine surgeries it actually has increased. Patients requiring them. So it has adversely affected. But as I said, if we continue to maintain, again, it's not this holistic approach what we are talking now. It's not new. It's actually though less, stress or less, we don't pay attention towards it. It's been a part of modern medicine. There's a department, where a post graduation is done, that is called preventive and social medicine. I'm pretty much sure not many people you must of people many of the people must not have heard about it, because these are the people who actually don't see the patients. These are the doctors who don't see the patients. They are more in teaching line, so you don't meet them. But most of our policy makers, most of our bigger programs of our government, they are run by these doctors. They are preventive and social medicine experts. So what I want to say is that preventive and social medicine has been part of medicine ever since. Of course, less stress has been made, probably because it's not that flashy. But yes, it's one of the most important parts of the medicine, which I think with time will get its due recognition.
Anuprit, I may want to intervene here, and I'm just requesting if we can just start taking.
Sure, sir, sure. We'll take up the questions first. Okay, so we have I think this is the question for Dr. Vineet. It's by Monica ma'am. My question is that from September 2019, I'm suffering from severe lumbar pain due to L4, L5 nerve compression. In December 2019, my surgery has been done in Apollo Clinic because I was unable to walk and sit. But after 1 year gap, this surgery did not work again. May 2020, I had the same problem.
See, Monica, what specialty has own, yes, not every medicine will work. Not every alternative medicine will work all the time. There are going to be failures. So I won't say that surgery is not the right option for lumbar pain. Selection of patient is very important. Since I don't know your case, what was the scenario? So selection of patient is more important. And failure of back surgery or medicine, it's not uncommon. I won't say it's common, it's not uncommon. And there is always a rescue plan available. So I can't comment much because I don't know your case fully. So probably if whenever you have time, you can either contact Varun and they can send me your reports, and then probably I'll be able to answer you in a better way.
Hello, sir. Good evening, doctor. Just want to ask. I'm Monica Mahajan. सर माय क्वेश्चन अगेन कि आपने जैसे मैं आपको बता रही हूँ कि सर्जरी मेरी हो गई आफ्टर 1 ईयर, इसने वर्क नहीं किया और मुझे सेम वैसे ही पैनिक अटैक आया और आई वाज मींस टोटली बेड रिडन. उसके बाद सर मैंने जो अपने आप को मैनेज किया हुआ है वो फिजियोथेरेपी और एक्सरसाइजेस के थ्रू, प्लस मेरी एक मेडिसिन भी मुझे लेनी पड़ती है, एक मसल रिलैक्स और एक न्यूरो पेन नर्व टैबलेट है जो मैं लेती हूँ, तभी मुझे मतलब रिलैक्स फील होता है. बट सर ये मेरी मतलब आपसे यही पूछना है कि इतना जो मेडिसिन की अगर मैं एडिक्टेड हो गई तो इससे मेरा कोई किडनी के ऊपर इफेक्ट आ सकता है, क्योंकि मुझे अगर मैं किसी दिन मेडिसिन ना लूं तो मुझे ऐसे लगता है कि मेरा अगेन नर्व में सर उसमें कम ऐसे नमनेस आ जाती है पैर में और मुझे फील होने लग जाता है कि अगेन प्रॉब्लम स्टार्ट होने लगी है. सो ये मेडिसिन मुझे क्या लॉन्ग टाइम लेनी ही पड़ेगी?
देखिए, as I said, कि it depends upon the kind of problem you have. It's very difficult for me to give answer appropriately without seeing your reports.
Okay, sir.
It's not just reports. As I said, you can contact Mr. Varun. He can forward me your reports,
Okay.
and then I can probably get back to you regarding what is good for you and what is not. But as I said, there are times when we fail in the treatment of the patient, and it's a known failure rate is there around 10 to 15% of the patients, they can have a failed back. This is what we call a failed back syndrome, and there are many rescue things available for such patients. So you need not worry. Let's see what is the problem with you, and then we can proceed ahead.
Okay, thank you.
I have a question. anyone can take that question, Dr. Vineet or maybe Anchal. See, they say that the child's brain develops between the early stages of the childhood. And with this pandemic, the children are not going to the school. They are not meeting their peer, online classes. What bad effect will that have on their psychology, their development, and especially their brain development?
Anshul, would you like to answer?
I don't mind. If you want to go first, you can.
Uh, See, ma'am, anatomical development will continue during these years. It is more of a social or behavioral aspects which suffer. The things which we learn, whether it is a social interaction or whether it is learning to behave with your class teachers, learning manners. So these are the things which they are affected, as long as it does not cross a certain limit. It doesn't become pathological. Most of the students, they will adjust as they start going to the school. Don't worry, your anatomical development will not be affected by it. Anatomical, the brain will continue to develop. It is the learning aspect which is affected, and sometimes few behavioral abnormalities, they creep in, which need to be rectified by taking help of professionals like Anchal. And then obviously they can be rectified. There is nothing that cannot be rectified.
Thank you.
Anshul, you can go ahead if you want to add something.
Yes. Yes. So firstly, to the last thing that we talked about, so I said it may be a reason for the males to get into the same, not only the reason. That is first thing. And next thing is to ma'am, you, that yes, sir has very rightly pointed out कि anatomically वो कोई असर नहीं डालेगा, but हाँ definitely cognitive processes में बच्चों के प्रॉब्लम आने लगेगी, इन द सेंस दैट डेवलपमेंटल इश्यूज आ सकती हूँ या ग्रास कर सकती हूँ, तो वो बच्चा शायद इतने टाइम में वो चीज ग्रास नहीं कर पाएगा. सो देयर द प्रॉब्लम्स कम इनटू द पिक्चर, एंड दैट इज आल्सो बिकॉज ऑफ लॉट ऑफ यूसेज ऑफ द गैजेट राइट नाउ एंड एवरीथिंग बीइंग ऑन द गैजेट. सो द ओनली थिंग दैट आई थिंक आई कैन सजेस्ट टू द पेरेंट्स आउट हियर इज कि जितना कम गैजेट यूसेज होगा फॉर योर सेल्फ ऑल्सो, बिकॉज आई थिंक चिल्ड्रन हु आर वेरी यंग चिल्ड्रन, if we are talking about, they go on with the observational learning. So if you are also doing the same things in front of them, they will definitely do it, right? So मैंने अपने घर में भी खुद देखा है that the children are not eating food without YouTube on, without watching TV. उनको पहले YouTube चला होना चाहिए तो वो खाना खाएंगे. So these are few things which you need to take into consideration, and you need to do the reinforcement, the positive reinforcement, the negative reinforcement, the punishment part here, जहाँ पे आप बच्चों की एक चीज को reinforce कर रहे हो कि अगर आप ऐसा करोगे तो आपको ये चीज मिलेगी, या अगर आप ये करोगे तो आपका ये चीज आपसे ले ली जाएगी. So these all things you have to bring into the picture, and doing some cognitive academics are taking time. Similar ways for children nowadays, if you're talking about the holistic wellness, we need to take out at least half an hour every day for cognitive building activities, where they're doing some crosswords, they're doing some puzzles, they're doing some mathematical fun activities, they're doing grain sorting. So all these kind of activities you can indulge your children into to build their cognitive abilities and the attention concentration activities that they can do.
Thank you, ma'am.
We'll go ahead with further questions. There's a question by Preeti. What type of diet should follow after a pancreas surgery? So I think I'm in a better position to answer this. After a pancreas surgery, you might feel very much full even after you're taking little food. थोड़ा खा के भी बहुत जल्दी पेट भर जाएगा. So the funda is to have small and frequent meals, and do not bulge a lot of liquid all at a time. Don't have 1 liter or half liter water all at a time. Take small sips, and especially before and after meals. Don't take all the liquid and food together. Take it with some gaps so that you are not full too much. And secondly, थोड़ा सा problem आता है fat absorption में. So you have to consult a nutritionist or a dietitian for this to take a control of fat in your diet. So especially saturated fats, they do not get digested very easily. A variety of foods so that you're nutritionally wholesome again after the surgery. And you might have been overweight after the surgery. So again, you have to consult a nutritionist or a dietitian who can help you with this. Going further with the questions, it's for, I think, Anchal ma'am. What kind of depression therapy we can do at home?
So I think the very one-liner answer is that there's no depression therapy that you can do at home. Number one is that if you feel that you're having any symptoms of sadness or of depression, please firstly visit a psychiatrist. Don't do any kind of self-diagnosis. Second thing which is important is go to a professional and seek therapy, or if needed, medications for the same. There's nothing that you can actually, that I can tell you right away, that this is something that you can do at home for yourself to come out of the depression, because I don't even know if you are having depression or not. So I'm not in the right position to tell you anything about the same. So one-liner answer is please go to a professional, get yourself checked, and go into the medication process and therapy process. And they will give you homework tasks and stuff, and they will give you therapeutic techniques, which will help you to understand that what all are the things that you can do at home also to feel better and to come out of that phases that you are having.
I think there is one question that we seem to have missed out. So my question is, somebody named Ms. Jitendra is trying to ask, I think primarily to Dr. Vineet Sagar, why is it so hard to change behavior? Well, I think it seems that it's an Anchal's question. So maybe I request Anchal if she would like to take it up.
I think Anchal should answer that.
Yeah.
Okay, firstly, I think here I need to understand what kind of behavior, ma'am, you're talking about. Because see, behaviors, of course, can be of different types. If you're talking about the anger, that you show a lot of anger, or maybe, what kind of particular behavior you're talking about. If you put a little light on the same, it'll be easier for me to understand that in which direction I have to go with you.
Jitendra, if you are hearing us out and if you are there online, so if you can come on the mic and talk about it. Ms. Jitendra, you would like to take it up? So I think maybe she is not available or not willing to come on the mic. So probably we can answer in a general note, or we can skip it for now.
On general note, I think, see, one is that, as I said, there are some core belief systems that we form from the very beginning, from our parenting or from our observational levels from the beginning. If I know कि जैसे बचपन में अगर मुझे सिखाया जाता है कि घर में मेहमान आए हैं और आपको ये पर्टिकुलर सामान नहीं खाना है, दिस इज फॉर मेहमान्स, राइट? सो दैट इज वन ऑफ माय कोर बिलीफ दैट आई हैव फॉर्म्ड, एंड दैट्स व्हाट आई एम टीचिंग माय चिल्ड्रन आल्सो अहेड, because I have learned it. It's a learned behavior from my parenting styles, and of course I've learned it from my observational things also. So कई बार जो behaviors होते हैं वो इसीलिए भी change करने difficult होते हैं क्योंकि वो आपका एक core belief system बन चुका है आपके दिमाग में कि मुझे इसी तरीके से behave करना है, right? I think she is here. Ma'am,
Jitendra, would you like? Yeah, Jitendra, go ahead, please.
Actually, I want to ask कि जब कोई मुझे कोई भी चीज चाहे अच्छी बोलता है या मतलब गुस्से में बोलता है तो वो मुझसे टॉलरेट नहीं होती.
अच्छी भी बोलता है तो भी टॉलरेट नहीं होती. अच्छी मींस यू वांट टू से दैट मुझे अच्छे वे से
एडवाइस दे रहा है तो वो मुझसे टॉलरेट नहीं होती और वो मेरा एंगर बाहर निकल जाता है.
ओके, ठीक है. So see, if I talk about the,
just to add a humor also, you are blessed to be a Punjabi, so this is one of an integral part of most of the Punjabi females.
Okay, But as I said, it can come from your particular childhood patterns also, that maybe because of certain reasons from the past, from your childhood, because of course I don't know you personally, I don't know about anything about you, so I can't comment on the fact, but that would be one of the particular thing कि आपके किसी childhood particular incident या जिस तरीके की आपकी parenting हुई है उसकी वजह से शायद ये particular behavior है. Secondly, I think the more you will take a time out in that particular zone. For example, I don't know if you're married or not, or of course you have a family. So अगर आपके mom ने for example कुछ बोला है या किसी particular इंसान ने आपको आके बोला है कुछ और अगर आपको वो चीज सही लग रही है या गलत लग रही है उसको analyze करने के लिए पहले आपको time लेना है. I understand कि हर situation में आप वो नहीं ले पाओगे, but अगर आप 10 में से एक situation में भी लेना start करते हो, it will be a win-win situation for you, Miss Kaur. So what you need to understand is taking a time out concept is very important. So time out is basically a concept which is very helpful for all people in the relationships. So I think this is for everybody, because हमारी जो सबसे ज्यादा problems आती हैं, जो भी behavioral issues आते हैं या एंगर इश्यूज आते हैं, वो इसलिए वो सबसे ज्यादा बीच में हो, तो वहां पे एक टाइम आउट कॉन्सेप्ट लेना जरूरी है, विच इज बेसिकली क्या म्यूचुअली उस इंसान के साथ डिसाइड कर रहे हो दैट ओके मे बी दिस इज गोइंग ओवरबोर्ड नाउ एंड वी हैव टू टेक अ टाइम आउट. सो लेट्स कनेक्ट आफ्टर हाफ एन आवर, लेट्स कनेक्ट आफ्टर 45 minutes, मे बी लेट्स कनेक्ट after a day or 2 days or something like that. So that particular time period will give you a particular help कि आप analyze कर पाओगे कि उसने जो बोला वो सही है या नहीं है. Second thing I think that I can tell you is that in this kind of situation कहीं ना कहीं एक bell जरूर ring होती होगी उस time या बाद में कि शायद मैंने जिस तरीके से react करा वो जरूरी नहीं था वहां पे या important नहीं था. तो start doing a thought journaling for yourself. Start writing the things कि मैंने ऐसा किया and it was not a right thing for me to do, and then in the side only write a particular thought that is a adaptive thought for you, that your mind will take and which is a realistic thought कि मैं ऐसा behave ना करके ऐसा क्या behave कर सकती थी जिससे this situation could have been resolved and my relationship with that person would have been better and I would not have been feeling guilty afterwards. राइट तो ये जो थॉट जर्नलिंग का पैटर्न है ये आपको बहुत हेल्प करेगा आपके खुद का माइंड यूज करने के लिए. किसी और को आके आपको बताने की जरूरत नहीं पड़ेगी. नेक्स्ट टाइम सिचुएशन होगी, मेडिटेशन हम 1 या 2 दिन में नहीं कर पाते हैं, वैसे ही ये थॉट जर्नलिंग प्रोसेस थोड़ा टाइम कंज्यूमिंग है. आपको इसको अपने डेली रूटीन में लाना पड़ेगा, तो जाके आपको समझ में आएगा कि धीरे धीरे आपको कैसे एक्सेप्टेंस लानी है लोगों के क्रिटिसिज्म के लिए खुद के ऊपर.
ओके मैम, थैंक यू सो मच फॉर योर एडवाइस. फॉर नेक्स्ट टाइम मैं यही चीज पे वर्क करूंगी.
Thanks, Anchal. I think I'm just moving on to the next part. This is for Anupreet. So I don't know the name. There's something mentioned HP. So I'm suffering from thyroid from the last 5 years. What kind of diet is useful?
Okay, so firstly, this is a very personalized thing. So I need to check the reports. I need to check T3, T4, and what medicine are you already on, and what might be the condition of your thyroid. But talking on a general note, I'd say you have to have 3 things, 3 basic nutrients: iodine, selenium, and zinc. So you have to have iodine-rich foods like you can have seaweeds if you can have those. And after that, if you're non-vegetarian, you can have eggs and fish as well. In selenium, you can have things like Brazil nuts and legumes and eggs. And in zinc, you can have dry fruits. So these are basic ingredient things you can include in your diet. Otherwise, I'll have to check with your reports and other conditions like the causes of your thyroid.
Fair enough. Thank you so much. I'm just cutting in. Maybe we have to skip few questions, but I think there is some diehard Salman Khan fan here. I can see being Salman Khan. So is it, I suffered from COVID during the second wave after I lost almost 12 kg weight. I have tried all kind of diets, but no result, due to which I'm having a mental stress and depression. Please suggest. So I think you both are experts here, one on the mental wellness, another on the diet side. So a diehard Salman Khan wants to, fan wants to know about it.
Anchal ma'am, you may go first.
Okay. So I think firstly, being Salman Khan, I'm also a very huge fan of Salman
Wonderful.
Khan though. So chalo, imagine the same platform then. So firstly, I think as you said, it's because it's after the COVID second wave that you lost 12 kg weight. So see, firstly, you need to understand that it's just because of the diet pattern you're having, or is it a physical issue that you're dealing with, right? I understand that all these things are inculcating in you a mental stress that you are having. But firstly, it's very important कि आप वो particular चीज को analyze करो, समझो by professionals, which is of course a dietitian, a nutritionist, and a physician who needs to understand कि post COVID ही ये चीज आपको एकदम से क्यों हुई है. Is it a medication that has put an impact, or any kind of I don't know what kind of medications you've taken in that time period. So what exactly have happened, or is it a particular thing that is going on in your life, which of course being Salman Khan, you would be the right person to tell कि क्या उस पर्टिकुलर टाइम पीरियड में साइकोलॉजिकली ऐसा कोई स्ट्रेस चल रहा था, कोई साइकोसोशल स्ट्रेस आपकी लाइफ में चल रहा था जिसकी वजह से ये सारी चीजें हो रही थी. सो अलोन just having a particular mental health regime will not be just enough for you. So here I think having a particular regime for yourself, a lifestyle management for yourself firstly is very very important, wherein आपका diet, आपका physical activity कितना है, आप सोते कितना देर हो, आप पानी कितना लेते हो, ये सारी चीजें बहुत इंपॉर्टेंट है. आपने पर्टिकुलरली इस चीज के लिए किसी फिजिशियन को दिखाया है या नहीं दिखाया है, वो बहुत इंपॉर्टेंट फैक्टर है. एंड उसके बाद जो भी चीजें, ये सारी चीजें अगर आप सही से करोगे तो हाफ ऑफ द स्ट्रेस विल ऑफ कोर्स रिड्यूस, अगर आपको वहां पे सोल्यूशन मिलेगा. एंड सेकेंडली आई थिंक द मोस्ट इंपॉर्टेंट थिंग इज दैट यू टेक सम टाइम आउट फॉर योरसेल्फ. जब भी आपको ये पर्टिकुलर थॉट्स आते हैं, जैसे मैंने आप अभी जितेंद्र को भी बताया था कि वो एक थॉट जर्नलिंग कर सकते हैं, तो आपके लिए भी सेम चीज है. पहला कि आप थॉट जर्नलिंग करें. सेकेंडली आपके लिए जो सबसे ज्यादा इंपॉर्टेंट है कि अपने लिए फिजिकल हेल्थ रूटीन आपको बनाना बहुत जरूरी है, जहां आप एक 45 मिनट्स या हाफ एन आवर का एक रोज फिजिकल एक्टिविटी कर रहे हैं अपने लिए. क्योंकि अगर आपका वो एक पर्टिकुलर फिजिकल एक्टिविटी का रूटीन नहीं है, दैट ऑल्सो पुट्स एन इम्पैक्ट ऑन योर हेल्थ, मेंटली ऑल्सो एंड फिजिकली ऑल्सो. सो इट कुड बी अ सिंपल नेचर वॉक ऑल्सो, राइट? एंड thirdly, I think what is important is that you need to have somebody to talk to. So I don't know if you're talking about your concerns to somebody or not. So please look back to a social support system where you can go and you can actually have a person जिसके साथ आप बात कर सकते हो. And fourth, I think please seek a professional help. फिफ्थ दैट आई कैन से इज कि आप कुछ पर्टिकुलर ऐसी चीजें अपने रूटीन में डालें जो आपके लिए सेल्फ केयर है, जो ऐसी चीजें जो आपको पसंद है करना. सो आई थिंक दो हिसाब से चीजें चलती है. पहला कि आप अपने आप को डिस्ट्रैक्ट करो उस पर्टिकुलर सिचुएशन में, और दूसरा आप एक्सेप्ट करो दैट दिस इज इट व्हाट इट इज एंड आई हैव टू डील विद इट, राइट? सो जब भी आपको एंजाइटी हो रही है इस चीज की वजह से कि मेरा वेट ऐसा हो गया है, मैं whatever, there might be some self esteem issues that also come across when you're losing weight, and there could be a lot of body image issues that you come across with. So if you are dealing with those particular concerns also, so I would really say to you that rather it becomes huge, you right away needs to seek a mental health professional's help. So use some positive affirmations also. If you're having the body image issues or self-esteem issues, try using some positive affirmation. Try using some gratitude activities for yourself. Every day just before sleeping, say 3 good things that you're grateful about. It could be it could be your mom, it could be any of the person that you met which helped you for a very simple small thing. And I think this goes for everybody. I think अगर हम लाइफ में थोड़ा सा ग्रैटिट्यूड दिखाने लग जाएं चीजों के लिए, तो लाइफ थोड़ी सी इजी हो जाएगी हम सबके लिए. So yeah, this is it that I can tell you. Baki, I think Anupreet would be the best person to tell about the diet part.
Thank you, ma'am. And again, adding to this, if you're losing weight, there could be again a vice versa thing. वेट लूज हो रहा है, इस वजह से मेंटल स्ट्रेस हो रहा होगा, और मेंटल स्ट्रेस है इस वजह से वेट लूज हो रहा होगा. दिस कुड बी वाइस वर्सा थिंग. And again, if you're losing weight, could be because of medications or the mental stress, or maybe you're reaching after the medication, after the treatment, maybe you're reaching back to your ideal weight. So if you're trying to reach back to your ideal weight, तो वो weight loss हम थोड़ा nutritionally sound कर सकते हैं. That's what we can do. If when I've come across with patients post COVID, the problem in them was they were losing weight very fastly. So the pace of your weight loss is very important. If you're losing like 12 kgs in 1 month, it's too fast, and that is a problem. But if you're losing weight like half a kg, 1 kg in 1 week, so it must be because you've got a certain change in your diet as well. So this is what I need to go through your 24-hour or 72-hour dietary recall. I need to know कि क्या खाया, किस time खाया, and again, was it protein rich, was it fat rich, was it carb rich? What kind of diet you are taking is very important for me to know. After that, you should consult again a nutritionist or a dietitian, because then they'll tell you what is the pace of your weight loss and what could be the possible reasons, because we just named vaguely the few possible reasons, but when they come across again holistically, जब आपका पूरा record बनेगा, then we'll get to know कि क्या exactly situation है, and we can help you out with that. And if you're not reaching this is after losing 12 kg, it's not your ideal weight. We'll help you get to your ideal weight nutrition in a nutritionally sound manner, because we need you to be fulfilled with nutrition, and so that you don't suffer from any other problem in future. Because again, we have I think Dr. Vineet would help me out with this. In the post-COVID era, in the post-COVID situation, patients में बहुत ऐसी problems आ रही, especially fibrosis की, that we've seen, and because of that, maybe you're losing weight. So you just need to get it checked, and you should consult a professional for this.
Thank you so much. It is so elaborative from both of you. So I think moving on to the next part. So Nitika somewhere again is asking about on a similar line. So she's looking at a diet plan for weight gain. So I think the life is too imbalanced. The people like me are looking for weight loss, and there are people who are looking for weight gain. So we have to respect the question and maybe answer for them. So well, the easy way is for people like me to share my diet plan, how I am gaining the weight. So maybe it helps for them.
So yes, again, weight gain. So just a weight loss hai, we make it nutritionally sound. Weight gain is also supposed to be nutritionally sound. It's not just about eating more food and sitting down, because it's जो उस तरीके का weight gain होगा वो fat gain होगा. Weight gain के साथ fat gain भी हो जाएगा. So we obviously do not want that. What we need is a little higher protein diet. Protein, again, if it breaks your weight, it makes your weight also. So protein rich diet हम weight gain के लिए करते हैं, थोड़ी सी fat rich, थोड़ा सा carb rich. You have to start eating a little more. You have to be mindful of eating. So the problem with majority of the weight gain people are, they are not eating appropriate food. They think कि junk food खाया तो weight gain हो जाना चाहिए, but again वो fat gain हो जाएगा weight gain की बजाय. You will maybe after few years you will start having higher heavier thighs, heavier arms, but you will not be able to gain appropriate weight जो आपके ideal weight होना चाहिए. So for this I have to check your 24-hour or 72-hour dietary recall. I need to know your lab reports.
Thank you so
also,
much. I think this is since we are running really short of time, so I'm just skipping a few parts. No. So just moving to the next part, what is the main reason of insomnia? Anybody would like to take it up?
I think one of the main reason is if you're stressed out, of course, you'll not be able to sleep properly, or you'll be sleeping too much. That is hypersomnia also. The second thing, I guess, आपका काम जिस तरीके काम कर रहे हो वो भी बहुत मैटर करता है. आप बहुत ज्यादा स्क्रीन यूसेज कर रहे हैं, that also starts affecting the gadget usage. These things also start affecting your particular sleep cycle. And अगर आप खाना बहुत लेट खा रहे हैं, I think that can also be the reason for your insomnia. And plus आपका traveling कितना है कितना नहीं है काम के लिए, because I think when I used to work in Delhi, there was a lot of traveling stuff, and that too, pollution and stuff like that. तो आप कहाँ रहते हैं, किस तरीके का आपका pattern है, आपका eating pattern कैसा है, all these things also matter. So and of course if I talk about the psychological perspective, अगर आप किसी चीज से stressed out हैं तो डेफिनेटली आपके दिमाग में बार बार वही थॉट्स आएंगे सोते टाइम में एंड प्रेफरेबली कोशिश करें कि सोने से पहले आप अपना जो रूटीन है वो सही रखें, इन द सेंस कि पानी आप अप्रोक्सीमेटली 7-8 तक पी लें, क्योंकि मोस्ट ऑफ द टाइम प्रॉब्लम ये भी होती है कि जब आप बहुत ज्यादा पानी सोने से पहले पी लेते हो तो बार बार आपको फ्रीक्वेंट यूरिनेट करने के लिए जाना पड़ता है, जिसकी वजह से अगेन बहुत लोगों की नींद डिस्टर्ब होती है एंड समटाइम्स आर नॉट एबल टू स्लीप बैक एंड देन लॉट ऑफ थॉट्स स्टार्ट कमिंग इनटू देयर माइंड. सो कीप योर ईटिंग पैटर्न ऑल्सो इन द मैनर कि आप सोने से कुछ टाइम पहले खाना खाएं. दैट अनुप्रीत वुड बी द बेस्ट पर्सन टू टेल कि कितनी देर पहले. एंड कई बार होता है कि लोग बुक रीडिंग करते हुए भी सोने की कोशिश करते हैं स्टफ, बट आई थिंक आई वुड नॉट रिकमेंड दैट, बिकॉज कई बार क्या होता है कि आप इतना ज्यादा घुस जाते हो उस बुक में और वो बुक इतनी इंटरेस्टिंग लगने लगती है कि आपको लगता है मैं अभी सब खत्म कर दूं ये, तो दैट इंट्रीग्स यू टू इवन रीड दैट मोर. सो एंड प्लस आई थिंक टीवी यूसेज अगर और स्क्रीन यूसेज अगर आप सोने से 1 घंटा पहले ना करें, दैट विल बी द बेस्ट थिंग फॉर योर बेटर स्लीप साइकिल. और जिस टाइम आप सोते हैं उसी टाइम पे रोज सोने की कोशिश करें. दैट विल आल्सो बी अ गुड स्लीप साइकिल हाइजीन. एंड आई थिंक बाकी अनुप्रीत एंड डॉक्टर विनीत if wants to add something they can surely.
I think thank you so
No,
much.
no, no.
Anupreet, if you would like to add
was
something
saying
here?
it's complete.
Okay, okay. So I think moving to the next, I think this is the final one that we have for now. How do I get out of the negative thinking?
I am always firstly amazed about the fact that whenever I do these kind of webinars, people ask so many questions in relation to their mental health. But to the opposite, they don't want to come to a psychologist or a psychiatrist for a professional help. So that is one of the things, there are a lot of dropouts that I can see in the sessions because, people say that it's ki nahi, hame nahi zarurat shayad, ya hum kar lenge khud se. They talk to you and then they, never call you back. So these kind of things, I think if I talk about a mental health professional, we see a lot of them. So I think firstly, एक डिफरेंस समझना जरूरी है दोबारा कि आप ओवर नेगेटिव थिंक कर रहे हैं या एक नेगेटिव थिंकिंग आपकी नॉर्मलाइज स्टेट पे है. आई थिंक आजकल प्रॉब्लम ये हो गई है हम सबकी कि हम हर एक छोटी छोटी चीज को भी बहुत ज्यादा बड़ा बना रहे हैं अपने लिए, अपने दिमाग में, राइट. अगर मैं स्ट्रेस्ड आउट हूं तो मैं उसको डिप्रेशन बना देता हूँ, अगर मुझे एंजाइटी हो रही है तो मैं उसको पैनिक अटैक बना देता हूँ, और अगर मैं को नेगेटिव थिंकिंग हो रही है तो मैं अपने आप को ओवर थिंकर में बना लेता हूँ, राइट. सो आई थिंक यहाँ पे आपके डिफरेंसेस बहुत क्लियर होने चाहिए. एक क्लियर बाउंड्री, आपको इंसाइट जनरेट करनी बहुत जरूरी है. आपको ये समझना जरूरी है कि आपका इंसाइट लेवल कहाँ पर है अपनी प्रॉब्लम्स के लिए और अपने कंसर्न्स के लिए, खुद के लिए, राइट. हम अभी अगर वी आस्क अबाउट समबडी कि आप इसके बारे में 5 चीजें बताओ, हम बहुत जल्दी बता देंगे सब कुछ, पॉजिटिव नेगेटिव एवरीथिंग वी कीप टेलिंग. बट इफ आई आस्क अपने बारे में कुछ बताओ तो हमें बहुत टाइम लगता है सोचने में कि हम अपने बारे में क्या बताएं, right? So I think here again, to how do I get out of negative thinking? Firstly, understand that we all have some kind of negative thinking in our mind, right? If I am doing this particular webinar, maybe before doing this or maybe right now answering your question also, my backend is saying कि कुछ गलत नहीं बोल दूं, right? It should not go in some other manner. So that is also a negative thing that is coming into my mind. But आपको ये समझना जरूरी है, I don't know the name, केयर प्लानर, कि ये जो नेगेटिव थिंकिंग है ये कितने टाइम तक आपके साथ रह रही है, किस फेज तक रह रही है. मुझे अभी स्ट्रेस हुआ, वो चला गया. मुझे अभी इसने मुझे ऐसा बोला, मेरे दिमाग में नेगेटिव थिंकिंग आई कि ओ शिट यार, मैंने तो ये काम सही से नहीं किया, मेरे से तो कुछ होता ही नहीं है. बट वो पर्टिकुलर थॉट कितने टाइम पीरियड के साथ आपके साथ रहा है, उसको पहले समझना बहुत जरूरी है कि मैं कितनी देर तक, कितने फेज तक उस चीज के साथ रहा हूं. इफ इट्स more than 2 weeks and it's recurrent, then you need to understand that you need help for the same, which is number 1, a professional help that you need to go for. And I think secondly, that what I can recommend you right now if you want to do something to get out of that negative thinking is that distract yourself, right? Do something that you like, talk to somebody. There needs to be openness about what you want to talk about. क्या आपके दिमाग में चल रहा है, उसके लिए बहुत जरूरी है कि आपके पास एक social support network हो, which I'm again and again repeating. Openness about mental health, talking, having awareness and having open conversations about mental health is very, very important. हम ओपनली इन चीजों के बारे में किसी से बात नहीं करते हैं, which again creates a lot of problems for us. So communication is something which is very, very important and need of the hour, which helps you to feel better about yourself. So I think जैसे मैंने बोला, थॉट जर्नलिंग आप कर सकते हैं, प्लस आप किसी से बात कर सकते हो उस चीज के बारे में, कुछ ऐसा कर सकते हैं जो आपको उस मोमेंट ऑफ टाइम के लिए डिस्ट्रैक्ट करे, राइट. एंड प्लस इसके अलावा प्रोफेशनल हेल्प प्लीज, इफ यू नो दैट इट्स गोइंग ओवरबोर्ड, और इनसाइट लाइए कि क्या वो ओवर थिंकिंग है या सिर्फ एक नेगेटिव थिंकिंग है जो कुछ फेज के लिए, और फिर इट्स बिकमिंग नॉर्मल फॉर यू, यू नो, यू आर एबल टू गेट इनटू द नॉर्मल एक्टिविटीज ऑफ योर रूटीन. So understand that difference. And I think lastly, if we're summing it up totally, so one last thing that I want to say, which I always say before ending all of the webinars that I do or the workshops, that I think there are some fundas that we need to understand for our life, कि मुझे अपनी life कैसे जीनी है. There are a lot of people who are actually having existential crisis कि मैं हूं क्यों, राइट. सो आपको वो समझना जरूरी है कि आप क्या हो, आप इस दुनिया में क्यों आए हो, आपके क्या पर्टिकुलर बिलीफ सिस्टम है जो आप आगे लेके जाना चाहते हो फॉर द अपकमिंग जनरेशन ऑल्सो. सो आई थिंक my personal 4 fundas that I love sharing it with people is that please listen. It's not because I listen, not because I'm a professional, I have to do that, but I think in general also you have to give a listening ear to people. I think most of the time आप लोग जब वापस जाएंगे, एक बार इस वेबिनार के बाद सोचना कि कई बड़ा दिल भरा हुआ था और मैंने सोचा आज मैं अपने दोस्त के साथ जाके बात करता हूँ किसी पर्टिकुलर चीज के बारे में, आपने किया, और वहीं पे ये देखना कि उस बंदे ने आपको कट कर दिया इन बिटवीन, और वैसी सिमिलर कन्वर्सेशन अपनी लेकर बैठ गए वो. सो वहां पे क्या हो गया, मेरी प्रॉब्लम नहीं रह गई, वो उसकी प्रॉब्लम बन गई है जो मुझे सुननी पड़ रही है बैठ के. एंड आई थॉट दैट आई गेट अ लिसनिंग ईयर, एंड वाइस वर्सा वी आर डूइंग दैट विद पीपल अराउंड अस. It's not that it's happening with us, it's a part and parcel that we're doing with people. So here listening is something which is very, very important, and with that listening, a non-judgmental attitude and being empathetic with people, understanding where they're coming from, right. People can have things which you don't imagine would everyday basis. It shook me also at many times कि अच्छा ये भी है, but it does happen. So it's okay, you have to take it in an easy way, listen, be empathetic, be a little non-judgmental towards what people are telling you, and practice gratitude every day before sleeping. 3 things that can make you feel happy, 3 things that you're grateful to anyone or to God. And lastly, hope. आई थिंक रात को हम रोज सोते हैं ये सोच के कि मुझे सुबह ये पर्टिकुलर टास्क करने हैं, बट सुबह नींद ही नहीं खुली, आंख ही नहीं खुली, तो क्या करोगे. बट तब भी हम सोते हैं 10 टास्क सोच के. क्यों? होप. सो होप इज वन थिंग दैट ऑल ऑफ अस नीड टू हैव so that we can lead our life in a better ways. Thank you.
Wonderful, wonderful answer. Please, Anupreet, if you would like to sum it up, then I make my concluding remarks.
Especially again, big thanks to Team Zorgers, because I don't know I would have met such beautiful souls today अगर ये organized ना हुआ होता तो. So again, gratitude. So thank you so much everybody for joining in, and again a big thanks to Team Zorgers. Holistic nutrition, I hope holistic health, I hope we take it forward and bring it to sustainable health, I hope. And that's all. Thank you so much.
Thank you so much on behalf of Zorgers. I think a special thanks to Anchal, Anupreet, and Dr. Vineet. I think you have the best of the professionals from the respective fields joining and sparing, their precious time, sharing their knowledge and wisdom with every one of us on the call today. I think at Zorgers, just as a reiteration, we are a home healthcare service provider working in the last 8 years, kind of improving the quality of life for dependent elders and bedridden patients. So if anybody is in touch of any such need, they can always ask us. We have our helpline numbers. At the same time, it is more important to know that from a journey point of view, we are moving towards a Zorgers 2.0 roadmap, which is more, it is going to be in terms of the holistic approach, being a physical home healthcare service provider. So we are going to talk about a much bigger aspects of, the subject that we just touched across. The nutrition is one of them, mental wellness is another of them, the in journals, the life coaching and things like that. So looking forward to see you again in our next series. Thank you so much once again. Thanks for joining in. Thanks.